Hello, my name is Colin Elton and I'm a consultant general surgeon based at the Clementine Churchill Hospital in Harrow. Today, I'm going to be discussing surgery to repair hernias. So, what is a hernia? Now let's imagine a brick wall and a few bricks fall out of the centre of the wall. That means that something can fall through that hole. That's very similar to a hernia. We have our own brick wall. One of these is the abdominal wall, which is the muscular layer protecting the bowel which sits inside our tummy. If you have a hole in this muscular layer, something, such as a part of the bowel, can fall through this hole. That is called a hernia. Now, common holes can occur in our belly button and in our groin, which is the area between the top of our legs and our tummy. Are hernias dangerous? Now, generally, a hernia itself isn't dangerous. However, in about 5% of cases where a patient has a hernia, something can get stuck in that hole. This can cause a blockage in the bowel or can block off the blood supply to an area of bowel or fat that has fallen through the hole. This is an emergency and usually results in an emergency operation. In most cases, however, people just notice that they just have a lump or pain or discomfort in that area. The reasons for surgery are to prevent that emergency situation, but also to relieve the pain associated with a hernia. What does surgery for a hernia involve? The operation always involves an anaesthetic. However, some patients like to avoid a general anaesthetic, and we can perform some hernias under local anaesthesia, which involves numbing the area over the lump. For most hernias, however, patients will need a general anaesthetic and are therefore completely asleep during the whole procedure. The procedure itself can involve keyhole surgery, placing instruments through small holes in your tummy and using a camera which transmits the areas of surgery onto a television screen. The hernia can be repaired with less pain when compared with open surgery. Now, open surgery usually involves a larger cut in the tummy, so you can imagine that the pain would be increased when compared with keyhole surgery. However, both types of operations involve repairing the hole in your muscular wall with a synthetic material called a mesh. This is a permanent material that will remain in your body throughout your entire life. There has been controversy in the media about the use of mesh, but I'd like to reassure you that 70,000 groin hernia repairs with mesh are performed every year in the UK. How long will I be in hospital? You should expect to go home on the same day of the operation, but please arrange for a friend or family to pick you up from the hospital. Before you leave the hospital, your doctor or nurse will give you advice on how to look after yourself, including caring for your wound, hygiene, and bathing. Please follow their advice to recover as quickly and safely as possible. Will I be in any pain after my hernia surgery? The first week is the worst, and you may find difficulty in going up and down stairs and performing your daily activities because of pain around the operation site. Please take the prescribed painkillers regularly. After the first week, you should find that things get a bit easier. My recommendation is to avoid work and driving for 1 week and any sort of heavy lifting for a period of 1 month. Can I exercise after my hernia repair surgery? Believe it or not, walking is a good thing. It helps to stretch the muscles and reduces the risks after surgery, such as constipation or the risk of blood clots in your legs. When can I drive after my hernia surgery? My recommendation is to avoid driving for 1 week because it will be quite uncomfortable to perform an emergency stop with a seatbelt wrapped around the lower part of your tummy. When can I go back to work after my hernia surgery? Many people feel able to return to work after 1 or 2 weeks. However, if your job involves manual labour, you will likely need more time off work. Can I prevent my hernia from returning? I want to reassure you that less than 5% of hernias will come back. I would advise you, however, to try and maintain a healthy lifestyle, as excessive weight can weaken the muscles of your abdominal wall, and smoking can lead to a chronic cough which could result in a hernia coming back. Exercise is good, and having operated on several patients who lift heavy weights in the gym or run marathons, I can tell you that these activities have not resulted in their hernias coming back. However, if you are concerned about the operation area following your surgery, don't hesitate to see your specialist again. We hope this video provides you with the information you need ahead of your surgery. If you have any questions, feel free to leave them in the comments section below this video. If you would like to arrange a consultation with me or the nearest consultant in your area to discuss this procedure in greater detail, you can book an appointment online at circlehealthgroup.co.uk. Thank you.